This has been a dream of mine ever since I was a medical student. I've always had a passion for not only being a physician, but owning and operating a practice. Towards the end of fellowship, I had the great fortune of meeting Dr. Luke. It became clear pretty early on that we shared a similar passion for doing what we love to do, which is help patients achieve their reproductive dreams and do that in a way in which we are delivering the ultimate service experience so that patients feel cared for, they feel special.
How most IVF centers function is usually generate cycles. There's not really meaning or purpose behind it. I wanted more. I wanted something more. Women empowerment, women rights to know, women to understand the biological clock in a better manner, in a kind of care that is not this typical word as in individualized, but close to their heart, like taking care of them like it's part of our family.
I think one thing that really differentiates Generation Next is that there is no one-size-fits-all policy for patients that walk through the door. And a lot of other centers do seem to take that approach. But for us, every patient's different. Every scenario is different. It would be so much easier to say, okay, this is the way we do it. This is how we do it for everyone. Just come into the machine, and then we're going to try and churn out a baby for you at the end of the day. But that's just not how we practice, and that's not what patients deserve.
There's no studies that have shown that one size fits all. Like there's no say this is the best protocol for this patient. Patients also varies in cycle to cycle. Not every cycle that's the same. So when we say individualized at our center, it's really a individualized protocol trying to cater to that patient for that specific month.
The best part of the job for me, when we check that result and the pregnancy test is positive, it's just high fives around the office. This is awesome, celebrate. It's so beautiful because it's not any one person's doing. It takes so many people to make that happen for a patient and for a couple. And everyone is working so hard to that goal so that when we hit it, it's beautiful.
And I have to add to that is when I get the baby pictures, they're the cutest, the cards, and it usually takes 9 months from they get pregnant to when the baby born. And so when you get the pictures, it has so many stories and memories of my interaction or Dr. Naja's interaction or our office interactions with the patient. So we all talk about, oh, do you remember what happened? And she did first IVF, and it is a joy to talk about that story. That's why we have this fertility gong in our office. Sometimes we hit that gong when certain tough cases. Not only high five, we have a gong to hit the gong, and then everyone in the office know who got pregnant, because it's getting a lot of gongs nowadays. Lots of gongs, so it's been exciting.